Hey Delmarva, welcome to LifeWorks PRMC. I'm Roger Follebout, the Director of Community Relations at Peninsula Regional Medical Center, and this is a brand new program for us and a brand new partnership with PAC 14. We're excited to be doing this. We're going to have some information for you about some of the non-clinical stuff that goes on at Peninsula Regional Medical Center that's still, we think, very important to you and your healthcare experience. Mary DiBartolo, as you know, has a great show here on PAC 14 called Focus on Health, and Mary handles a lot of the clinical things. She also has a lot of our clinicians and our physicians and other folks from our healthcare institution on the program with her, so we certainly don't want to step on Mary's toes, but we want to bring you the great information about the things going on at Peninsula Regional, like wayfinding, how you find your way around the campus, which is now almost 1 million square feet. How we protect your healthcare information, things like how we get you to and from different places on the medical center, things that you need to do when it comes time to, say, prepare for your surgery, or how do you pay a bill, simple things like that that are still very important to you. You know, one of the real key issues facing all of us in healthcare today, whether we're a consumer or whether you're like me and you work in the healthcare business, is the changing climate of healthcare and healthcare reform, and it is happening very, very rapidly, not only here on the Eastern Shore, but across the United States. Here at Peninsula Regional Medical Center, the gentleman who's in charge of keeping us up to date on what's going on with healthcare reform, and also to take a look as far as 10 years out or longer at the medical center and plan where we're going to be and what we're going to be doing, is our Vice President of Strategy and Business Development, Chris Hall. And Chris is with us as our first guest on the program. So Chris, welcome.
Well, thank you, Roger. Appreciate to be here.
Good to have you with us. As you'll find out here on the program as you stay with us and follow us here on LifeWorks PRMC, what we want to do off the top of the show is to give our guests an opportunity to introduce themselves to you and give you a chance to learn a little bit more about each and every one of them. So for the first couple of minutes, this is the Chris Hall Show. So Chris, take it away.
As you mentioned, I'm new to Peninsula Regional Medical Center. I started in August, about 7 months ago. Relocated down here from outside of Washington, D.C. Grew up in Cape May, so I grew up with sand under my feet, like you do here on the Delmarva Peninsula. Attended SU for undergraduate, and from there went on to Johns Hopkins for my master's in strategic marketing. Spent 20 years at Adventist Healthcare working in their strategic planning and the regulatory side, and as the opportunity presented itself here at Peninsula Regional, took advantage of that opportunity.
And your father, too, probably the most important role that I play, in addition to the career, is a father of 3 children, relocated down here with me, as well as my wife, Sherry. Awesome. Well, welcome.
Thank you.
Great to have you at the medical center. As we mentioned, we're going to talk about healthcare reform here in the first program. And you know, it's really such a general topic, Chris, and it really is fluid. It's changing every day. It is so hard, you know, to hit that target as to what healthcare reform is going to mean to the consumer and to the general public. So, if you don't mind, I'd like to start talking first about how healthcare reform is going to affect Peninsula Regional Medical Center, because I'm sure that as it affects the medical center, there is that trickle-down effect that it will have on the consumer and the general public, and all of us on the Delmarva Peninsula too.
Absolutely right. I think in the near term, you're not going to see dramatic changes. Today, tomorrow, in the next year or so, if you have an emergency, you're still going to call 911. You're still going to follow the orders of your physicians. Babies will still be delivered at the hospital. The healthcare is continuing to evolve, and currently, the hospital exists when people are sick, and we sit here and we provide the services to those that are in need. However, as you move forward, I think it's going to become more patient-centered. Patients will be the center of the attention.
Let's talk a little bit about that, because that's a term we hear a lot these days, the patient-centered home. What does that mean? Can you explain that for us?
Part of that is all about wellness. Hospitals, as I mentioned, were there when people get sick. I think hospitals need to take a greater role in partnerships with others as that evolves on really partnering with the patient. A great example of this, in very simplistic terms, Peninsula Regional has 3,000 to 4,000 employees and dependents on their medical plan. Within that medical plan, there are several individuals that are sicker and some are healthier. So we take a look at the ones that are sicker through the Infomed, who is our third-party administrator of the claims for the insurance company, and we can find out who really uses healthcare services the most. And with that crowd of individuals, or that segment of the population, we can work with their primary care physician, provide care coaches, transition coaches, and wellness coaches so that they will become healthier. As the patient becomes healthier, they start using less services. So a patient-centered medical home really focuses, again, on the health and the wellness of the individual patient.
And this isn't something that just PRMC is involved in. This is across the country.
This is across the country. It could be any hospital in any of the states. Everybody's starting to try to figure out how, as a hospital, they can provide better health to the communities.
You know, I know I've been at the hospital for 14 years now, and I know you're new to it, but you've got a great background in healthcare, and you were at Adventist on the Western Shore for a number of years. You know, one of the things that Peninsula Regional got into very early in its existence was partnerships. I mean, they've been involved with different and various partnerships almost since the time the organization came about in 1897. So one of the things I want to ask you about is the partnerships that the medical center has now with corporations out in the community to provide that continuum of care where we're not necessarily just taking care of the patient within the walls of the medical center, but we're looking at what we can do for that patient once they leave our care as well.
Yeah, and I think the date 1897 is an important one. Hospitals continue to evolve and always have been a hospital. That's their core competency. Many organizations throughout the 90s try to become an integrated delivery network where they're purchasing all these other disparate companies, home health, nursing homes, surgery centers, and the like. I think Peninsula did the smart thing over the years. They partnered. They realized it wasn't their core competency. So the nursing home out on Route 50 with Genesis, they've partnered there. They've partnered with the surgery center, Delmarva Surgery Center. They partner with an imaging company for x-rays and the like throughout there on Route 50 as well.
Yeah, the Woodbrook complex.
The Woodbrook, right. And home health. So they've partnered with a number of outside support organizations so that they didn't, it wasn't their core competency, but yet for a patient, the transition between those levels of services were more appropriate and they could place the patient where they needed to be.
And you really try to create that seamless transition for the patient as well, right?
Correct.
Given that we're in this period of rapidly changing healthcare, how important was it for Peninsula Regional to already have these partnerships established?
It's absolutely critical. For instance, where I came from, Adventist sold off 6 of their nursing homes. So now they don't have that partnership anymore. They sold it off to an outside company. They have no interest in the organization, financial interest. So now it makes it a little bit more difficult as you're replacing the patients. But I think one of the things that you're going to find out as we go forward, the information record is going to be important. Because if a patient comes into a hospital, they have a medical record, they have their admissions. When they go to the nursing home or they go into home health, say, it's a great example. If a mother comes in and delivers a baby, the baby has some issues, maybe high bilirubin, they go home, they may have a home health nurse come home with them. Well, that information of the mother and every bit of the care that they had at the hospital will also go with the home health. Being in a partnership, that makes it a little bit easier.
And that's all that electronic medical record that we've heard about, right?
Correct.
And all the sharing of information between not only Peninsula Regional and its partners, but other hospitals, right? I mean,
even statewide.
Ideally, what you're looking for is if you know, God forbid, something happened to us on the Western Shore, our information could be accessed by Shock Trauma University of Maryland for the care that we received at Peninsula Regional and other places.
Yeah, with Peninsula Regional having many tertiary services, as you mentioned, trauma, the NICU, the neonatal intensive care unit, open heart surgery, one of only 10 providers in the entire state having that, there are sharing of systems with many others across the state. So yes, that information is available and will be greater at a greater rate.
You know, PRMC for years has been the community hospital in this region, the largest, the most experienced, the most advanced. And it's always been kind of, let me make this analogy, it's always been the hub, as I see it, of the wheel. In other words, Peninsula Regional was at the middle, and off of the hub came these spokes, being patients or whomever, and everybody came to the medical center for their care. I'm hearing a lot now that that concept is changing, and the medical center is moving away from the hub, that the patient is becoming more of the hub, and the medical center is coming to the patient, and others are coming to the patient to provide that type of care. Is that all part of this changing?
It is absolutely part of it. Healthcare reform is looking to, as I was mentioning, finding ways to partner better with the patient. The patient has greater choice. Patients will be working more with or closer with their primary care physician in the future. So when they're working closer with their primary care physician, they now start looking at where's the best setting of care for me. Maybe it is a hospitalization, maybe it's not. Maybe it's I need a surgery at an outpatient surgery center. So they'll start looking at not only cost of the service, but also the quality. So the journey that Peninsula Regional has been on for increasing the quality of care that they're providing and in the right settings, you know, that is the crux of healthcare reform. Being at the crossroads right at 13 and 50, the Delmarva Peninsula, yes, they have been being a great asset in the community if somebody needs hospitalization. However, I don't think that is going to be the crux of a hospital in the future. Hospitals, like you mentioned, many of the spokes where the patient's in the center.
Mm-hmm. And the way healthcare looks now at Peninsula Regional, vastly different down the road, I would suspect as well, where primarily the hospital becomes the entity that cares for those patients that are absolutely terribly sick, or those requiring the emergent care.
Yeah, you'll still have the emergency room. You'll still have moms delivering babies at hospitals. You'll still have, but like you mentioned, we call it the ICU, the intensive care unit. Patients who have to go through surgery or have as you mentioned, really, really sick, they'll still be coming to the hospital. Some of the other ones, over the last couple of years, they've been going into what we call an observation status. They don't need to be in the hospital overnight. They may not be really, really sick enough. In the past, they probably would have been there for a week. Yeah. But now they've been dropped down to an observation status. Within about 23 hours, the doctor's observing them to see if they are candidates to stay at the hospital or if it's really sick enough. If they're not, then they're discharged to home or home health. But in the future, you know, it's where the community lives.
Sure.
So we're really working with, as you mentioned, the joint venture partners that are in the community. And also, you know, for instance, Millsboro, we're putting up a 48,000 square foot medical office building there, bringing more care out to where the community lives. And that's just one example, because we have about 8 different primary care physician locations all scattered throughout Sussex County, into Worcester, and even in Somerset, and even in Accomack County.
Mm-hmm. That Millsboro Health Pavilion that you mentioned is really an outstanding complex going up right there on Route 13, or 113 in Millsboro. Tell us a little bit about that and where we are in the progression of that building.
It's under construction right now. Steel and framing is in process. What you'll see in there, it's about a 48,000 square foot office building, and it's going to be a medical pavilion is the best way to look at it. You're going to have a complex array of services. From primary care, you'll have some specialty care in there. We're setting up a great example of condo. We have several physicians who aren't ready to expand and add on physicians to their practice, but yet they want to spend time up there. So we'll rotate through 1 or 2 days a week, and we'll have multiple specialties come through. In addition, there's several others, specialty care, which I can go into. We just don't have the contract signed today.
Got it, but we're getting close on those, right?
Very close.
Absolutely. All right, we have about 2 minutes left in the show, Chris, so I'm going to toss the crystal ball your way. I'm going to let you take a look in it and give us an idea of where you think healthcare at Peninsula Regional Medical Center and on the Delmarva Peninsula is going to be maybe a decade down the road from where we are now.
And I think it's going to be a slower progression. You'll see, again, we'll still be the hospital that people have counted on in the past. They'll continue to use it in the future. But that transition will be slower as they're working closely with their primary care physicians. 10 years from now, I think you'll see a lot more consolidation in the marketplace. Not just hospitals, but you'll see insurance companies, other providers, a lot more consolidation. It's kind of like what the railroads went through back in the day. They always thought they were in the railroad business. Hospitals and Peninsula Regional, thank goodness, has realized this years ago as they went through transitions with their executive team, having a greater focus on ambulatory care. But the Peninsula has done a great job realizing they're not just in the healthcare business or the hospital business, they're in the health business. So they're setting up that. You'll see greater partnerships with gyms. I'm not saying the spandex type of gyms, the Bally's, but more the medically based fitness, where primary care, rehab, all those are integrated. So I think you'll see a little bit more of, again, patient-centered is a great example. The idea that we're using with our employees, that is kind of more what you'll see across the United States. We're partnering the patient with their physician, trying to manage their chronic conditions. Because as patients get older, seniors utilize services 3 times more greater than the rest of the population. How do we keep people well? That's the key.
Sure, and reduce those readmissions.
And reduce them.
Absolutely. Great information. Chris, thank you very much.
Thank you, Roger.
Appreciate you being with us. That was Chris Hall, the Vice President of Strategy and Business Development at Peninsula Regional Medical Center here in Salisbury. Hey, thank you as well for being with us on the program. We do appreciate you watching and sticking with us. And look, we're here to talk about those topics that you want to see as well. So if you have some ideas that we can use here on the program on LifeWorks PRMC, please drop me a line. I'm at roger.follabout@peninsula.org. We'll put that on the screen for you. Or you can always call me at 410-543-7142. Until we see you next time, take care, Delmarva, and thanks for joining us here on LifeWorks PRMC.